Begin by washing your hands as you would before any procedure.
Hello, good morning. My name is Martina. I'm going to be your nurse today. May I get your first name and date of birth, please?
Yes, hello, good morning, Nurse Martina. My name is Mrs.
Introduce
Brown,
yourself
and
and
my date
ask
of
for your
birth is
patient's full
March
name and date of birth.
24th, 1959.
It
Okay,
is
great. Thank
important
you. I
to
have the
proceed
correct
with
chart.
double
And how often would you like to be
identification
addressed?
to ensure you have the right
Lucy's
patient in
fine.
front of
Lucy's
you.
fine. Okay. And
Make
I
sure
use
this
the
matches the
pronouns
patient's
she,
chart.
her. Okay, great. Thank you. I have the correct chart. And how would you like to be addressed?
Lucy's fine.
Lucy's fine. Okay. And I use the pronouns she, her. May I ask what your pronouns are?
The same.
The same.
Ask
Okay.
for the sex
And
assigned
what
at
gender do you
birth,
identify
as
as?
this information
Female.
helps
Okay.
guide the rest
And
of the
what sex were you
evaluation.
assigned at birth?
For
Female.
example, it
Female,
might
sorry.
demonstrate the need for an
Throughout
organ
Symptom, you'll see
inventory
me be
that
taking
will
some notes
orient your
down,
next
just to
assessment
update
steps.
your file and make sure I have all the correct
An organ
information.
inventory is a detailed
So let's
assessment
talk
of the
about what's been
organs
going on.
and
What's brought you in
anatomical
today?
structures present
Well,
in an
I'm
individual.
concerned because I've
So let's talk about what's been going on. What's brought you in today?
Well, I'm concerned because I've experienced some vaginal discharge.
Okay, I'm sorry you've been experiencing this. So what's going to happen today, I'm going to start asking you a few questions just to update your file first, and then I'll move on and ask more specific questions specifically related to the discharge, so just to sort of determine the overall best course of action, okay? Do I have your consent to continue?
Sure, you have my consent.
Great. And if
It
you
is
ever feel
important to
uncomfortable at
listen
all
and
with the
acknowledge
interview,
what the
you
patient
do
is
want to take
experiencing.
action, you do have the right to refuse
And
and
remember
always
that
move on to the
obtaining
next question.
informed consent
Thank you.
is essential before
Okay,
proceeding
so
with any
let's start by
assessment.
updating. If you ever feel uncomfortable at all throughout the interview and you don't want to answer a question, you do have the right to refuse, and we can just move on to the next question.
It's essential to remind your patient that they can refuse any part of the assessment that makes them uncomfortable. This helps build a trusting nurse patient relationship in an ethical and patient centered manner while respecting patient autonomy.
Okay, so I'm just going to start by updating your file. So can I get your emergency contact information?
Yeah, you can put my friend. Her name is Rose Stacy.
Okay. And may I have her phone number, please?
Yeah, her phone number is 514-358-9555.
Okay. And may I ask what your occupation is?
Well, I'm retired, but I was a secretary at an NGO for a long time.
Okay. How have you been feeling since you've been retired?
Oh, I feel great. I have more time for myself.
Okay, great. That's nice to hear. So I'm going to move on and ask more specific questions related to the symptoms that you've been having, as I mentioned. So you came in because you were experiencing some vaginal discharge. So when did this first start?
Well, my vaginal discharge started about 1 week ago.
Okay. And have you noticed anything that makes it better?
No, not really. No, nothing makes it better.
Nothing. Okay. And does anything make it worse?
No, nothing
Okay.
makes it worse.
And do you know, is the vaginal discharge just coming from your vagina?
Well, I think so.
Okay.
I have no discharge since I've been in menopause. So a discharge for me is very unusual.
Okay. Okay. And can you describe the consistency for me? Like, is it clear, cloudy, thick, or thin?
It's kind of thick, cloudy, and with like green tint.
Okay. And do you find that it has any odor or smell to it?
I haven't noticed any smell.
No? Okay. Are you using anything like panty liners or pads?
I do both.
You do both. Okay. And how often would you say you're changing them?
Well, and during the day, I use the panty liners, and I roughly change them about 4 times a day because it's completely soaked. And at night, I use a pad, and when I wake up, it is also completely soaked.
Okay. And would you say that the discharge is continuous, or do you find that it sort of comes and goes, and maybe it's more heavy in the morning or during the day or the evening?
Oh, it's constant, and
You
there's
find
lots
that
of it.
It is constant. Okay. So just to summarize, I want to just understand correctly. So you use about liners 4 times a day. They're soaked, and overnight the pad is soaked as well when you wake up the next morning, correct? So is that about after 7 to 10 hours, you would say?
Yeah.
An effective strategy to ensure you understand what the patient is telling you is to validate their words.
Okay, thank you so much for sharing.
This
Kind of helps me
builds
better
trust
understand
and
the
rapport
situation.
with the patient and facilitates shared decision making.
Daily activities and your daily life.
Well, this discharge is embarrassing, so it really has an impact on how I connect with people.
Okay, and what do you mean by that? How you connect with people?
Don't hesitate to ask for clarification when you're unsure you understand what the patient is trying to communicate. This avoids misinterpretations and ensures accurate understanding.
I guess I mean like, when you want to be intimate with someone, having what's happening with discharge.
Okay. I understand if this might be difficult to talk about, so I thank you for sharing that. Do you have any ideas of what might be sort of causing the discharge? Have you had this before?
No, I never had this before.
You may need to acknowledge in a transparent way that sexuality is a sensitive topic to encourage the patient to open up. This will create a supportive environment where patients feel safe to share vital information about their sexual health, leading to better health outcomes and a more positive healthcare experience, addressing potential stigma and allowing for informed decision making.
Have you experienced any trauma or injury in the vaginal or genital area?
No.
Okay. And have you noticed any other symptoms that came around at the same time as the discharge? So any itching, burning, maybe bleeding, any changes in urination, maybe?
Well, I noticed that I'm peeing more often and it
Okay.
hurts.
Okay. And when you say it hurts, what does that feel like? Can you describe that?
Kind of it burns.
Okay. And do you urinate frequently and in small amounts?
Yes.
You do?
Yes.
Okay. And when you do feel that need to urinate, do you find that it's kind of just impossible to wait and hold?
Oh, exactly. It's
Yeah.
impossible to wait.
Okay. Do you find yourself waking up maybe at night to use the bathroom more often?
Oh, yes, I
You
do.
Okay. And what about any blood in the urine? Is that something you've
No.
noticed? No.
No.
And the urine itself, is it cloudy, dark? Again, is there any smell or odor to it?
Well, sometimes it's cloudy, but there's
Okay.
no odor.
Okay. And in terms of genital hygiene, how would you describe your genital hygiene? So, for example, how do you clean and wash the vaginal area?
Well, I use only water and unscented soap.
Okay.
And I shower daily.
Okay, and this is your sort of regular routine. There hasn't been any recent changes, any changes in soaps or anything like that?
No. No.
Okay. And do you know what the lining of your underwear is made of?
Yes, it's cotton underwear. I wear cotton underwear.
Okay. And so previously you mentioned that there was nothing that really makes the discharge better or worse. Is there anything that you have tried?
Well, I try to wash more.
Okay.
And the discharge keeps coming back, and I don't really know what else to try.
Okay, that's okay. Any other problems like in the genital area? Any lesions now or in the past that you've had?
No lesion or sore, but I feel a discomfort here.
Okay, and here you're pointing sort of to the lower abdomen
Yes,
area.
yes.
Okay. And when did this discomfort start?
Well, same time as the discharge, but 1 week ago.
Okay. And so on a scale of 0 to 10, 0 being sort of no pain at all and 10 being the worst pain you can imagine, how would you rate the pain?
I would say a 3.
A 3. Okay. And do you find that it moves anywhere else, sort of in the abdominal area?
It's really there.
It's just in the
really
lower
there.
abdomen. Okay. And again, is there anything that you find that makes that worse?
No.
Okay.
No.
Anything that makes it better or helps the pain?
Well, I try Tylenol, so I use Tylenol twice a day.
Okay.
Each tablet is 325 milligrams, and it
Okay.
helps.
Okay. And after you take that Tylenol, how would you rate your pain at that point on that same scale?
Well, it goes down to 0.
It does. Okay. And again, is that pain constant? Is it always there, or do you find it comes and goes?
Well, it kind of comes and goes, and I would say I feel it about 3 times a day.
Okay. And what kind of pain do you find it is? Is it a sharp pain? Is it a dull pain?
Well, it looks like menstrual pain, like cramps.
Okay. So thank you for that. Thank you for answering those questions. So I'm going to continue and get a little bit of a past medical history.
By explaining the rationale behind your questions, you help your patient understand the purpose of the question and encourage them to answer. This approach fosters a sense of collaboration, making patients more likely to share accurate and complete information.
Do you have any medical conditions?
I do. I have cholesterol and thyroid problems.
Okay. And any breast-related illnesses?
No,
No. Do you take any prescribed medication?
I do. I
Okay.
take Lipitor. It's 20 milligrams each night before I go to bed.
Okay.
And I also take Synthroid, and it's 25 microgram, and I take this every morning before breakfast.
Okay. And that's for the cholesterol and the thyroid.
Yeah.
Okay. Do you take any vitamins or any herbal or over-the-counter medications at all on
Yeah,
a
I
daily
do. I
basis?
take melatonin,
Okay.
like 5 milligrams, and I
Okay.
take this at night, and also the Tylenol that I mentioned before.
Okay. And have you ever been hospitalized? Have you ever been to the hospital for an overnight stay for any reason?
No,
No. Okay. And have you ever had any surgeries on the uterus, ovaries, or anywhere else?
no,
Okay. Do you have any history of any injuries or accidents in the past?
no. I'm kind of a pretty careful person.
Okay. And in terms of allergies, any allergies to specifically any medications?
No,
Any food?
no,
Anything sort of in the environment? Bees, pollen?
no,
No. Okay. And how about any childhood illnesses that you have? So anything like chickenpox, measles, roseola that you might have had recently?
not that I know of.
Not that you know of. Okay. So have you ever received the human papillomavirus or the HPV vaccine, as it's being called? So that's a vaccine that protects against cancers of the cervix, the vagina, vulva, and genital warts caused by this virus.
I had, yeah.
You
I
have,
do.
okay. And thinking about your parents, your siblings, and your grandparents, is there any history of things like diabetes, heart diseases, polycystic ovarian syndrome, maybe ovarian cancers that you know of?
Not that I know of.
Nothing, okay. And when was the last time you saw a healthcare practitioner for a checkup?
I saw my NP about 10 months ago, and I'm due to see her again in 2 months.
In 2 months, okay. And do you have a history of any transmissible diseases? So things like HIV, hepatitis, syphilis?
No,
No, okay. And have you ever been pregnant?
no, but I would have really liked to. But my partner was not able to conceive, and he passed away, I would say, about a few years ago.
Oh, I'm really sorry to hear that. That must have been difficult.
Thank you for your kind words.
Show empathy when patients share their life experiences by actively listening, validating their feelings, and providing supportive feedback. This builds trust and encourages open communication, leading to a more positive patient care experience.
So if it's okay with you now, I'd like to go over just a little bit of your menstrual history. Again, just might be giving us a little bit of additional information to help us understand really what's going on. Can you tell me about your menstrual periods? When was the last one?
Remember, by explaining the rationale behind your questions, you help your patient understand the purpose of the questions and encourage them to answer.
Well, my last menstrual period was 15 years ago. Like I mentioned, I've been through menopause.
Okay, I see. And at what age did you have your first period?
13, I was 13.
13. And so before menopause, were those periods regular, you would say?
Oh yeah, they were pretty regular. They were like about 28-day cycle,
Okay.
and then lasting, I would say, 4 or 5 days.
Okay. And did you experience any issues, things like spotting in between periods?
No,
No. Okay. So during menopause, did you experience any symptoms such as vaginal dryness, maybe?
yeah, vaginal dryness. But now it's much better.
Okay.
And you know, honestly, menopause was not so bad.
Okay. That's good to hear. And when was your last gynecologic checkup? And were there any sort of particularities?
Well, it was last year with my NP, and everything was fine.
Okay. And do you know when your recent pap smear was and what the results of that were?
Yeah, it was also last year, and the results were normal.
Okay, great. So now I'm going to address a little bit about your sexual history. So that might be related to what you're experiencing, and also help me see if there's any screening tests that might be necessary, and if so, which ones would benefit you. Is that okay with you?
Yes, thank you. Yeah, sure.
Okay.
Here is another example of how to provide rationale during the interview.
Okay. Are you currently in a relationship?
No, I'm single.
Oh. And are you sexually active?
Yes, I am.
You are. Okay. And do you know how many partners you've had in the last 6 months or so?
I've had, I would say multiple partners in the last little while. I would say about 4 or 5. Yes, thank you.
We sometimes feel uncomfortable to ask questions about sexual history, especially with older adults. However, most older adults are not reluctant to discuss sexual activity and welcome the opportunity. It is essential to ask the relevant questions.
And do you feel physically and emotionally safe with those partners? So, for example, like, do you ever feel sort of pressure to do something that you might not have really maybe wanted to do?
Oh, absolutely not. I feel safe with all my partners.
Okay.
It is essential to routinely screen for intimate partner violence, as anyone can experience violence regardless of their background or circumstances. Regular screening helps ensure that individuals who may be suffering in silence receive the support and intervention they need.
And do you know the gender identities of your partners?
Yes, male.
Male. Okay. And if I can ask, what type of sexual contact are you having? So is it oral, vaginal, anal,
Oral and vaginal.
oral and vaginal? Okay. And are you using any new products, lubricants, or any sex toys during sex?
No.
No. Okay. Are you using any protection to help against acquiring any sort of sexually transmitted bloodborne infections, so STBIs that you might have been heard being called, such as maybe condoms?
Well, sometimes, but I don't really pay attention to this. I usually leave it to my partner to decide. All my partners are really good people. I'm really not afraid of that.
Okay. Have you had any sexual contact, do you know, with any partner that has had an STBI, such as gonorrhea, HIV, herpes?
Not that I know,
No.
but I haven't asked.
Okay.
And like I said, all my partners are doing very well. They're doing fine, and there were really no issues.
Okay. And have you yourself ever been tested for an STBI?
Never.
Never? Okay. And do you know, again, have your partners ever been tested?
Well, I'm not sure. I didn't think that SBI testing was so important.
Okay. Well, it's going to be a part of a little bit of the recommendations that I'm going to share with you at the end of our interview together. And if you'd be interested in discussing a little bit more about STBIs and how to protect yourself, I can most definitely provide you with that information if you're interested.
Yeah, it would be great. There's so much information out there that it's really
Remember that the data you collect during an interview helps to guide your health promotion interventions. This will enable you to tailor interventions to meet the specific needs and concerns of the individual, ensuring more effective and personalized care.
So thank you for answering all those questions so far. So now I'm going to move on a little bit to more of your health and lifestyle, as they might have an impact on your sort of overall health status. Is that okay with you?
Yes, sure. Continue.
Okay. So I'm going to start with your diet. Can you describe sort of a typical diet for me?
Well, I eat 3 meals a day, and I really try to eat lots of veggies and like fresh foods.
Okay. And do you smoke?
No.
And do you vape?
No.
No. Okay. Have you ever smoked or vaped?
Never.
No, you haven't. Okay. Do you drink any alcohol?
Well, I do occasionally. I have like 1 glass of wine, I would say, about once a week.
Okay. And any use of any recreational drugs, so things like marijuana or cocaine?
No.
Now or in the past?
No.
Okay. So we spoke a little bit about your sexual health earlier. Do you use any drugs or alcohol while having sex? So the reason why I'm asking this is really to identify any situations that might increase risks to your health.
Absolutely not, dear.
No. Okay. Okay, so before ending the interview, I'm just going to do a quick review of systems just to ensure that I haven't missed anything, okay? So have you been experiencing any fevers lately, any recent weight changes, or any other illnesses that
No.
you haven't mentioned to me?
No.
Okay. Have you experienced any nausea, any vomiting, any changes in your bowel habits maybe?
No.
No. Okay. Have you been experiencing any recent, like, unexplained sadness, change in mood maybe, any stress?
Well, I'm worried. I'm a bit worried about not knowing what I have right now.
During the review of systems, focus on relevant system related to the reason for seeking care. For example, here, the nurse picked mental health because the patient mentioned that her symptom affects how she connects with people.
Okay, so thank you so much, Lucy, for sharing this information with me. So we're going to do a physical examination, possibly some tests, just to better understand what's causing your symptoms, if that's okay with you. Do you have any other questions for me that you'd like to discuss before we get into the physical assessment?
No, no, I think that's everything for now. Thank you.
Great, thank you.
Thank you.
All right, so this is your gown. You can change into this. Or you can just pull the curtain and I'll be back in a moment, okay?
Once you have completed your health history interview, physical examination, collected all the relevant data, and identified your nursing impression, remember that health promotion must be part of your tailored interventions. You should provide resources that are patient centered, and in this case, a follow up will be required.